Boom, boom! You might have felt some back pain just like that sitting here. Hi, Dr. Tam. I want to give you some information that's going to blow your mind. Do you have three things? Disc herniation, disc bulges, or a protruding disc that's causing you pain? It's aggravating, it's excruciating pain, it's waking you up at night, not allowing you to tie your shoes, you can't sleep, you can't function at work, you're staying really tired, can't play with your kids, can't do things with your loved ones, can't be intimate, can't hang out with your family, can't go on family gatherings or events, and maybe it's preventing you from traveling. If you have pain like that and your doctors or medical primary care is just telling you, hey, take this pill, there's no surgery that could be done, maybe some physical therapy, well, you're in the right place, because today I like to share with you what really happens when you have a protruding disc and what kind of problems a herniated, protruding, or a bulge disc can cause. What kind of problems would it cause for you? Now, number one, before you watch any further, if you have been enjoying my videos, please comment below, like us below, and please share it, okay? So, moving on. What is a disc herniation, bulge, or a slip disc, maybe some people call it, or a protruding disc? Literally what happens, wait a minute, let me get my bone. Here they are. So the bones here, you have one that is absolutely normal and one that is in degeneration mode. Now they look completely different, and here's why. Is because this normal bone is, you probably have some of them. It doesn't matter if you're 70, 80, 90 years old, you may still have some bones that are normal. But you may also have some bones that has been degenerated and it's wearing and tearing away. Now what a lot of people don't realize and tell you is that bone wear and tear and degeneration is a natural process that happens if your body has been out of alignment, has never really been well adjusted. And it's called degeneration is because it's a chronic problem that if you do nothing about, pills aren't gonna fix it, okay? PT alone is not gonna fix it. Exercise alone is not gonna fix it. If indeed it's compressing a nerve. Until you get that nerve decompressed in this area, the pain is not going to get cured by a pain medication. Now you might say after taking a medication, you're going to say, you know what, the medication didn't work. It only worked for 4 to 6 hours and didn't work for long term. What you have to realize is medication is designed to work for 4 to 6 hours. It's not meant to work as a long-term thing. Right? Because it never really fixed the problem. It didn't get you from here back to here. Now, I want to explain something to you. How this process happens from here to here is something called accidents and injuries, which cause premature wear and tear, okay? Which ultimately cause degeneration to the joint. And now we have to help it by really, this joint now and this disc is compressing a nerve. And you can see these nerves are nice and healthy and a lot bigger in circumference, and these are a lot smaller. Because when a nerve is compressed, it's no longer going to provide the same energy, power, and sustainability for the organs and the muscles that this nerve is controlling like it would a good nerve. But, well, Dr. Tam, what do I do? I've been taking medications, I've been doing PT, I've been doing everything, I've been doing exercises. Well, the pain keeps coming and going. Well, when you come into our office, the difference is, number one, we're gonna really sit down and talk with you to see what really is the problem. Then we do a nerve assessment, a physical exam, neurological exam to see whether or not if this nerve is impinged, okay? Part of the exam that we're going to do is a sensory nerve where we test the sensation in your legs and the knees. And if you have a difference in sensation, well, it's going to be a nerve problem. There's no doubt about it. Then through x-rays, or if you have your MRIs, give me your MRIs, I'll take a look at them and really see where is the disc bulge. Is there a disc bulge herniation? Is there a protrusion in there? Now, if you do, the best thing that you can do for you is, number one, non-surgical spinal decompression. Why that is so important is because when you're standing, when you're sitting, there's a lot of pressure on your spine and there's pressure on your disc. Even when you're laying down, Well, what do you think? Oh, when we're laying down, there should be no pressure on the disc. Wrong. When you're laying down, there's less pressure on the disc. Even when you are in one of those inversion tables, there's still pressure on the disc. It's just less. It's still positive pressure. It's backed by science. Positive pressure is pressure that is doing this to your spine. Okay? Now, negative pressure is something that's going to open up and create a negative pressure. Negative pressure in science is also known as a vacuum. What happens then is that's the only way you would have the ability to vacuum, okay? Virtually vacuum the disc back into a space. And when the disc is back to its space, now it's no longer impinging the nerve. Well, you might ask, well, Dr. Tam, what kind of problems will this nerve or disc impingement cause? Well, let's take a look at it. If it's in the lower back, not only are you going to experience back pain, you can experience leg pain. It can be calf pain. It'll wake you up at night. This nerve also controls your bladder, your sexual reproductive organs. It also controls your colon as well. So any positive, extra positive pressure is going to be bad for you. And non-surgical spinal decompression is really the only way you're going to get a negative pressure created within the spine and have the ability for it to virtually suck the disc right back in to its normal space. So now it's no longer compressing on the nerve, okay? Now that's the cause, and that's a solution to correct the cause of the problem. You have to know, medications aren't gonna do it. Exercise alone is not gonna do it, all right? If you have a disc herniation protrusion or a disc bulge, you have to consider non-surgical spinal decompression. We offer that here in our office. We're one of the very few places in Solano County that even have these machines. You know, when I expanded my office 2 years ago, almost 3 now, I made it a point to first off get one of these tables. But I've realized that I've been able to help so many people. We now have multiple tables in our office now to be able to help many, many more people. I've helped hundreds of people over the last 3 years with problems with spinal disc decompression, spinal herniation problems. So if you have that and you're lost, maybe you just feel like, wow, no one's really listening. They aren't sure what's going on. Every time you go in and tell them what's the problem, they're just kind of brushing you off, not really figuring out the cause of your problem. I mean, aren't you sick of just trying to cover up the symptom? Covering up the symptom, taking a pill just for this, it's like saying your engine light just came on. All you did is you put a piece of tape over your check engine light, and now you just continue to drive. Would you do that for your car? No! Would you really? No, you would not. And since you won't do it for your car, why do you do it for your body? See, pain is your body's way, your body's only way to tell you something's not working right, okay? Listen to your body. I know we will. Hope to see you in our office soon. Give us a call. Our phone number is below. Schedule an appointment. Mention the fact that you watched this video, and we'll take off $300 off your initial exam, and your initial exam will be $47. Okay? Hope to see you in the office soon.